Welcome back to the Oral Health Podcast. Now you're about to listen to a conversation that Karen, our other co-host, had with Emma from Salivary Gland Cancer UK. Now, salivary gland cancer is a less common form of mouth cancer. However, it is just as important to raise awareness of this throughout the month as it is all of the other more common types of mouth cancer. I learned a lot listening to this, and I hope that you will as well.
Good morning, everybody. Morning, Emma. It's really nice to meet you. I've been really looking forward to speaking to you and learning more about salivary gland cancer, because I know obviously it is a rare cancer, but obviously nonetheless very important, certainly for Mouth Cancer Action Month, because obviously the salivary glands are in the mouth. But I think people are unsure exactly where that is. So we'll have a chat and see if we can get some more information out there. So first of all, would you like to tell us a little bit about yourself, Emma, please?
Yeah, thanks so much, and good morning, everyone. And Karen, it's lovely to meet you in this forum. So thanks so much for inviting me to come along today. I'm delighted to share a bit more about salivary gland cancers, what to look for, what the current issues are, and what we're doing about it. So I started Salivary Gland Cancer UK 5 years ago as a medical oncologist from the Christie Hospital after my lived experience of salivary gland cancers. And we've been going from strength to strength because, as you very rightly say, they are rare. They affect about 5 people per million in the UK every year. Although they are predominantly in the head and neck region, about 75% are, they also have primaries in other anatomical sites, such as the lacrimal gland, the trachea, the vulva, and the breast. So they're often missed within those care pathways. And going back to the head and neck, which is obviously the focus of today, about 50% occur in the major salivary glands, which are, and I'm indicating now on Zoom, but you won't be able to hear this on the recording, and that's the parotid, which is kind of near your ear, sublinguals at the front, and the submandibular, which is kind of under the back of your jaw and your ear. So that's about 50% of them, and then another 25% occur in the minor salivary glands, or the secretory glands, which are in other parts of the head and neck. So they're all the glands that are on your tongue, on your hard palate, on your soft palate, the roof of your mouth, and the cancers can also grow sort of in your sort of nasopharynx area and sort of behind the eye. So yes, they are head and neck cancers, 75% in the head and neck area, in the major and the minor salivary glands. Does that make sense?
It absolutely does, and hopefully we'll be able to put up a diagram. I doubt many people know where they are. I always used to say to people, your parotid salivary gland is when you have something really, really sour and it kind of puts that little wobble through you. That's your parotid gland reacting to it. And sometimes some people, when they open their mouth, they get the little spray from the sublingual. Not everybody has ever experienced that, but those are kind of where they're based. And I think it's really important that people are aware. So when you're diagnosed with salivary gland cancer, I can imagine it's quite difficult because there are other reasons why you might have swellings in those parts of the mouth. So, I mean, misdiagnosis, is that an issue?
Absolutely. I mean, it's a huge issue for us because these cancers, unlike other head and neck cancers, there's no risk profile. If they're complete equal opportunity cancers in the worst possible way. So you can present in your mid-30s with a sort of facial teething, and people might just think you've grind your teeth and you've got a stressful job and don't worry about it. Not that you've got a ball of cancer growing from your hard palate. Similarly, if you present with a watery eye, or a lump in your parotid, it could be nothing. And quite often there are stones in the parotid gland, and they're not malignant. They are benign. But yes, so it is a massive problem for our patient population. And of course, that means that diagnoses are late and prognoses are poor. Surgery is expensive, and as we all know, know if you're diagnosed past stage 1 or 2, treatment with curative intent is less and less likely. Combined with the fact that adenoid cystic carcinoma, which is one of the most common salivary gland cancers, can be asymptomatic and loves to invade nerves. So you can have this nerve invasion within the face, which will give a tingling or maybe a sort of slight twitch or whatever. But that could be a number of different things. I mean, just to finish the point about adenoid cystic carcinoma, it also loves to metastasize. So patients can be successfully treated, and then 15 years later, out of the blue, it can jump out again. Most commonly in the lungs. I think the last thing to say, which is an extra added layer of complexity, is that there are no approved targeted drug therapies. So unlike other head and neck cancers, where you can have chemotherapy, you can't. I mean, you can have it if you really want it, but there is no evidence to show that it is, an effective treatment for salivary gland cancers. So, research is decades behind that of other cancers, and biologies are still very poorly understood. We're doing everything we can to change that at Salivary Gland Cancer UK with the help and support of wonderful organisations such as yours. So thank you for having us and letting me share all this.
I think it's really, really important that we raise awareness, because I mean, I've certainly seen patients come in with swellings in the parotid gland or underneath their chin and at the back of their jaw, and it is often put down to salivary gland stones, etc. And I think it's important that patients do realise that these are all parts of the mouth that they should be checking when they're checking underneath their tongue and their palate, etc. And obviously visiting their dentist regularly, the dentist will be looking for those kind of things. But it is really important, if you notice anything different in your mouth, any swelling in any of these areas that we've mentioned, that you go and get it checked out. And I know what dental access is at the moment, so go to your GP and push it if necessary, push for a referral, because that's the only way it can be caught quickly.
Just to jump in, Karen, I couldn't agree more. Push to get the referral, but also I've had patients who have been referred and they said, "No, we don't need to do biopsy. We know it's a stone." It's like, well, could you do the biopsy, please? I absolutely agree with everything you say. I'm sorry to interrupt, but I just really wanted to back that up.
Yeah. So treatment is surgery and radiotherapy, is it currently?
Correct, it is, yes.
Yeah, okay. And obviously, with stage 3 and 4, we would like to get it sooner, because the complexity then of the treatment is much less, and there doesn't have to be such dramatic surgery, which then it brings us on to the next question that I wanted to ask you, Emma. And the people from your group obviously are very, very important, and I just wondered if we could just speak about how it affects people day to day, and the diagnosis through treatment to aftercare.
So I think there's probably two parts to my answer. The first is, dealing with the treatment itself, whether that's living with surgery. So maybe you've had part of your tongue, part of your jaw quite often, part of your neck quite often goes along with some other surgery higher up. We've got patients, I know this is a little bit beyond the scope of this podcast, but we've got patients that have lost their eye, that have lost their ear, and they will live with the changes, not only in how they look, but how they function. And also, if you've had radiotherapy to a number of these areas, you know that it's going to be a decline over time. So you're likely to get cataracts, or you're likely to get deafer, your neck's going to get stiffer, your mouth's never going to probably go back to a full pelt when it's saliva. So it's living with all of those things that are also declining. I think, and that will be very similar to, and probably shared by a lot of people listening to this. I think the second thing, which is, it's not unique to salivary gland cancers, but it's not common in all the other cancers, is that because there are no targeted drug treatments, living with adenoid cystic carcinoma by a friend of mine who passed away last month of metastatic adenocystic carcinoma has been described as standing on a burning platform. And that is exactly the way the patient population feel. You know that if you get Mets, essentially at the moment, there's nothing which can effectively treat those. Something might stop them growing for a bit or might get rid of them for a bit, but there's nothing that's licensed and proven. And that obviously we all have scan anxiety, and everyone has fear of recurrence. But I think with adenocystic carcinoma, because they do metastasize, they grow very slowly, patients can live with many, many years without that fear, or with them growing slowly in the body. So I think there's sort of two sides to my answer. Does that make sense?
Absolutely, absolutely. So it's a day-to-day, functioning, but it's also, having that hanging over you, must be really difficult to live with. But not just for the patient, but also, the families, their relationships, the work life. It affects absolutely everything. And we talk a lot about PTSD and mental health issues that can be raised by, after you've had your treatment. It's almost like, right, we've done it now. That's it. Bye. See you later, kind of thing. And it's like, that isn't the end of the journey. It's always the beginning, isn't it, really?
Yeah, no, absolutely. And I think also that, needs and effects change over time. Yes, of course, your neck might get stiffer over time. That's kind of expected and not out of there. But, you see patients who have been treated a long time ago, or been living with disease for a long time, or chronic condition for a long time. And, their mental health can go up and down. And that's not predictable. And I think that, there are lots of challenges for patients, not just with getting dentists, although that is definitely one of them, but also within the psychological arena. And that's where I think, patient organizations, we all do as much as we can, don't we, to support our networks through those difficult times. Yeah.
I think it's really, really important, because nobody supports like somebody who has bought the t-shirt, kind of thing. And we find that with other mouth cancer ambassadors that we have. You get them in the room together, and they're just brilliant. They're brilliant together. And, they may not have ever met each other, but they have a strand that holds them all together, and they can talk to each other like they can't talk to anybody else, really, which is a great support. I mean, looking at support with salivary gland cancer, what professional support is actually given at the time of treatment and after? What's done well, and what could be better?
I think, obviously I've painted quite a sort of grim picture of it all, and I think it's really important to be clear to anyone listening that there are a large amount of people diagnosed with a salivary gland cancer that have surgery, may not even have radiotherapy if it's very early caught, and then, if they've got ACC, adenocystic carcinoma, the likelihood of them developing metastatic disease is low. And I think it's really important to say that not everyone has this really awful prognosis. It's just that because of the complexities that we've discussed, the people that do are in a very difficult position. But I think it's important that, yeah. So, I think when you're initially diagnosed, if it's caught early, it should be relatively straightforward and the support is there. And then, of course, because 75% of these are in the head and neck region, you can have a lot in common. If you're going through radiotherapy for ACC, it's exactly the same as if you're going through radiotherapy for squamous cell carcinoma or HPV positive carcinoma, and the effect on someone at the age of 25 versus the age of 65 is going to be the same regardless of those treatments, regardless of what type of cancer you have. So there's probably quite a lot out there for head and neck patients. Generally, I think the difference obviously is in the biologies and the treatments, the more involved treatments and diagnosis, as we've discussed, is different. So I think in certain places there's quite well, we always need more support, but there is support out there. There are areas which we desperately need to address, and that's somewhere as a charity we started addressing. So research is desperately needed. We set up a research working group, and by the way, it's open to everybody with with an interest in salivary gland cancers. You can find it all on our website. But so that's absolutely brilliant. We hold regular gatherings, bringing clinicians and patients together to get support and also access to people that understand these cancers. I mean, if you're a GP, you might never meet a salivary gland cancer patient, and it's not you can't really blame that GP for struggling with the diagnosis. So that's another thing we need to do is, raise awareness, which is what we're doing, and also we need proper guidelines, which is a charity we funded as well. So that's a really long answer, and I'm totally off topic. The answer to your question is there are aspects, I think, where support is available, but there's a lot of work to do. I'm just, launching the research working group earlier this year was a very cheering. It's such a it seems like such a small word, and it was an amazing experience for me, and I think Dr. Metcalf personally, because we've been going for 5 years, and suddenly we had over 25 people that cared about these cancers. If you were diagnosed 12 years ago in the UK, there was like one or two researchers, and so there's definitely advancements such as whole genome sequencing, the anatomically agnostic trials, such as the Determine trial, where you can send the HER2 positive salivary duct cancer patient to join some breast cancer patients within that trial arm. All of these things are moving things forward at a pace, which is fantastic. And I'm totally off topic now.
That's absolutely brilliant. It's great to know that things are moving in the right direction. And yeah, research is key to all of these things, and awareness. Like we say, if we can just send one person who may be listening to this that's felt a swelling or tingling, or has got a very weepy eye or anything like that, if we can send one person and they can get checked out, and if it is if it is the worst case scenario, then they're in the right place at the right time, and that's what we can do. And as I say, it's only a few years. I've been with the foundation many years, and we started off with very low awareness of mouth cancer at all. That is rising. That is something that we're very pleased with. However, salivary gland cancer seems to be the sort of forgotten little brother somewhere along the line here. And, just because it's rare doesn't mean to say that nobody's going to get it. It's still, even if it is 5 people in a million, that's 5 people that we can give support to.
Yeah, thank you so much for that. Obviously, I completely agree with you. But I think as well that now is a time where we can effectively move things forward. And so it is, it's fantastic that people are, more interested in these cancers.
I mean, we find one of our other one of our ambassadors did actually say comes to the forefront when somebody famous has it, which is like any cancer, isn't it, really? And we have somebody famous talking about it, and all of a sudden it's in the news and everybody wants to know about it. But we would like that to be 365 days of the year, not just the month that we kind of are out there saying, please look, please check yourself. It takes 2 minutes once a month. Just make sure you know what's normal for you, and anything that isn't normal for you, just go and get it checked out and push if you have to.
And I think that as well now, dentists are better at checking and looking and being aware of what it is. And I think maybe 10, 12 years ago, that wasn't the case.
No.
So I think that's good, but obviously education needs to continue.
So Emma, if we look at salivary gland cancer on its own and its treatment, what are the differences in getting treatment from somebody who has experience in this field particularly?
Thanks, Karen. So I think it's really important to be treated by a clinician where possible that's had experience with salivary gland cancers, or at least someone that's aware of, the work that's being done and the latest research, because there are no approved targeted drug therapies. If a patient needs, additional scans, additional follow-ups, which would be beyond the usual follow-up for a more regular cancer, if you like, then the clinician needs to know that that's a need and be able to refer on to a knowledgeable, maybe a clinical or medical oncologist, if needed. So I think it's really important that salivary gland cancer patients are connected with charities who are knowledgeable in this area so that they can signpost to clinicians where needed that are knowledgeable in this area. And we do a lot of that. We do a lot of signposting. And every patient, of course, is welcome to a second opinion. I mean, if it's a very straightforward, surgical operation with no follow-up, then no problem. But if it's a complicated case with, metastatic disease, you want your tumor profiled. You want to be in the biobank. You want to be on the list if a drug trial comes up. So I think it's really, really important that patients are aware of the expert resources that are there and are signposted appropriately.
I think that's brilliant. Yeah, that's some really, really good advice. And we will put all of your details, obviously, on the website and following this podcast. So anybody that has any worries can get in touch with you, and I'm sure that they will get the best advice available.
Thank you very much. That's great. Very much appreciated.
I hope you enjoyed that conversation. Like I say, I definitely learned a lot, so I hope that you will as well. All of Salivary Gland Cancer UK's information is in the description of this podcast, and please continue to raise awareness throughout the month using #MouthCancerAction on social media.